Ideally, the ward environment should be able to support a parent to have contact with their infant. So that really involves having an appropriate family-friendly visiting space that's set up for infants. So has things like facilities for nappy changing and infant-appropriate toys or safe spaces for babies. It also needs to have appropriate staffing resources that can allow for supervision and support for families, especially in those initial visits. And that can be quite tricky to navigate in terms of staff time and the impact on staffing. For our LHD, we often use our perinatal infant mental health clinicians to provide that support around contact, but certainly nursing staff and other allied health staff on the ward are absolutely able to do that, particularly when it's an out-of-hours visit or there's no PIM clinician involved. So it's really important to have a sense of how you can support a family during contact time. So in terms of infant visits, ideally initially these should be kept relatively short and focused, just to give staff a chance to observe how things are going in that interaction between the mum and the parent and the baby. And that can be extended as the parent's mental state improves and as it can be seen that those visits are progressing well. And obviously, ideally, that can progress to periods of leave off the ward for that contact to occur later in the admission.
Naturally, from a psychiatric perspective, we would be monitoring mum and pacing her along the way and monitoring to see how well she's coping with that. Sometimes when babies come to visit on the ward, they can feel like a healing moment for the mum, that she's able to reconnect with her baby. It's very sensitive for the mother, and we have to also monitor how she is actually able to cope with a baby visit. Sometimes it can be very overwhelming. They can feel overwhelmed. It can reinforce their thoughts in an unhelpful way that they're not being the best mum they can be.
At all times, we should consider the safety of the baby as paramount, but also the emotional well-being of that parent. So we need to make really good observations of the interaction and also be able to document those in the clinical file. So these don't have to be comprehensive assessments. They're just simple, objective observations of what you've seen in the interaction. So how well mum's able to engage with baby and for how long, whether she's able to respond to the baby's cues, how settled the baby is, or if the baby's unsettled, whether mum or dad feels able to settle that infant. So it's really important that we're making those observations, because that can help to guide future visits and also discharge planning in terms of the readiness for that parent to be back in contact with the baby.
Nursing staff are also often in that unique position of actually observing those initial visits and supporting whatever happens in the anxieties and worry before the visit happens, observing to see what's happening during the visit. How is mom feeling? How is baby feeling? Is baby responding to mom? Is mom responding to baby in a way that we feel is healthy or is something that's going to be good for the mother? And then after that visit, when they've had to say goodbye all over again, actually being able to sit with the mother and have those conversations around what it was like, and making a plan going forward.
If visits aren't possible for whatever reason in terms of the parent's mental health or the acuity of the ward, that really needs to be explained to the parent and the family and the reasons for that given. Otherwise, it can feel quite upsetting and difficult. And where possible, we should try and make alternative arrangements. So it might be that phone calls or video contact with older babies are appropriate, or sending a video message or an audio message to the baby and back might be a really good way of keeping in contact. So it's good to think creatively with consumers about how they might like to manage contact if that face-to-face visiting time isn't appropriate.